Coming up next on Wellness for Life, Allison from Medichair is giving me a lift.
We're going to go over some products that are going to keep you independent and mobile in your own home.
And now, Newswatch at 5:30 continues.
Hi, I'm Dr. Doug and welcome to Wellness for Life. We're down here at Medichair Home Medical Equipment, and I'm with Allison, one of the owners here. Allison, come up a little higher where you're at my height here, where we can chat. And that's a lot better. So, Allison, we have a chair lift here, a stair lift that you're talking about. And can you please just go over what group of people would use this? And these are actually less expensive than most people, than I actually originally thought here. Better cost than moving. And for really under $3,000, you can keep mobility in your house with this kind of equipment. Is that true?
Yeah, that's exactly true. So you can install it if you're having trouble getting upstairs to where the bedrooms or bathrooms are. People will install them there, or even into the basement if that's where your laundry room is, and you're having trouble carrying the laundry basket up. You can install this. It helps you move from one floor to the other easily and safely.
Yeah, and you guys do the complete installation, all of the details to get this up and running for people, correct?
Yeah, absolutely. And it mounts onto the stairs instead of the walls, so you don't need to worry about what your wall is composed of.
All right, so this is a great piece of equipment to keep the body mobile, and that's what we want. Somebody might just not be able to go up and down stairs with hip or knee problems, but once they get up and down the stairs, they can keep their mobility. So my objective is to keep you up and going as long as possible, as well as Allison's here. So why don't we convert over and take a look at the actual chair lifts so we can keep mobile in our home once we're on an individual floor.
Yep, absolutely.
Okay, great. Let's head on over. And here are the lift chairs, Allison. Can you go over what these are about and how they help people in their house?
Sure. So if you're having a little bit of trouble standing up and you're spending too much time sitting in your chair because it's uncomfortable trying to get up to a standing position, these will do all that work for you. So they take all the pressure off your knees and your joints and bring you up to a nice standing position, nice and easy, not too fast, and you're up and ready to go again.
Yeah, and these would be what I would see as people with knee problems, possibly hip problems, and low back. All would be candidates for these chairs if they can't get their body to the state of health where they can continue to do that. This is a great way to do it. And so we've got a couple of them here at the end. We're going to have a seat in and take a look at some of the features here.
Sounds great.
So could you just go over the features of these different chairs and what we would look for and look at? Sizing would be important, obviously, a big person like me versus a smaller person like yourself.
Yeah, that's exactly true, and that's why we have so many models on the floor so that people can try out what's appropriate for them. And we also have about 40 to 50 different sizes that we can order in. So for you, we need something that's quite tall.
Yes, a little bit there. And that's important, though, because this is a piece of furniture. You want to sit and enjoy reading or TV or whatever it is, but then be able to get out. And we were talking earlier how, you know, a typical person who has mobility issues might sit down in the chair and then they flop there all day because they can't get back up. And that's something you see.
That's correct. Yep, we see that quite often, unfortunately. So this really brings back that independence and keeps them mobile. And of course, you want to keep moving as much as you can, keep those joints working.
Yeah, and you mentioned this chair here is fairly specialized, correct? That it can actually bring me into a complete parallel to the floor position and help with some edema and fluid levels and things for getting up, correct?
That's right. So this particular chair that you're in has 2 separate motors in it, so you can recline the back separately from lifting your feet up. So you can keep your feet elevated, but you can keep your back upright if you want to watch TV. But the back will also go right down, so it's actually lower than your heart and your feet. So if you have any swelling in your feet or you have problems that you're dizzy when you stand up, it can really help with your circulation.
Yeah, so these are great assistive devices. Obviously, both of us interested in keeping people mobile, keeping them active.
Independent.
Independent. In my case, it's keeping you up. And then at certain points, if you need assistance to keep going, people like Allison here at Medichair are great people to find out more about this equipment. So why don't we get ourselves worked up? And another thing is these are a slow process because we don't want it vaulting forward, so it's a very safe piece of equipment as well.
That's right, yep. So you never feel uncomfortable that it's going to push you out of the chair. It just brings you up nice and gently to a nice standing position.
Well, we want to thank Allison here at Medichair for helping us up. We'll look forward to getting out there, getting active, and getting Dr. Doug's joints up and moving. Take care, and we'll see you next time.
Bye.